This week's topic is all about COVID-19, aka the coronavirus. We've certainly heard a lot about this over the past month or so, but today's webinar is really focusing on facts and information. So I thank you all for joining us today. My name is Ashley Ritchey. I am the director of the New Jersey Self-Advocacy Project, which is a division-funded program of the ARC of New Jersey since 1983. My team and I support a statewide network of self-advocates and self-advocacy groups, and part of our mission is things like this, bringing information and resources to self-advocates as well as staff members who support self-advocates, students and adults with disabilities throughout the state. So part of this webinar series is really in line with our Healthy Lifestyles Project, which is a program all about teaching students and adults with intellectual and developmental disabilities about all areas of health and wellness. Especially this week, we'll focus on COVID-19. So just a note, you all are invited to present questions, feedback, comments throughout this presentation. I just ask that you use the questions box, looks like this. So if you do have questions, just type them in right there and we will address them throughout the presentation, and I will make sure to add time to the end of this presentation or save time at the end to address those questions and comments. Just a quick note, all of the information included in today's presentation is based on facts and information that we have as of today, so April 14th, 2020. I appreciate that you all signed on today and are part of this presentation, but I also urge you after this presentation is over to continue checking credible sources for current information about COVID, staying safe, social distancing rules. So today's discussion is really going to focus on facts and questions about COVID-19, aka the coronavirus. We will be devoting some time to dispelling myths and misinformation about the virus. We're also going to discuss tips for staying active and healthy during COVID-19, during the pandemic. I think that the purpose of today's webinar is to really share knowledge. Knowledge is power, and I want everyone to walk away from this presentation feeling empowered to discuss the virus in a responsible and healthy way with people around you and with the people that you support. So I know if staff members from group homes, different programs for adults with disabilities are logged on today, I hope this information is helpful to you in expressing the facts to the folks that you support and who you work with. And we're also going to discuss a super important topic, managing our stress during this stay-at-home order. We're all spending a lot more time at home, for better or worse, and I think it's really important that we talk about some really functional tips about staying active, managing stress, and dealing with what we're all going through together. And when I say staying active, I also mean staying active as a self-advocate and as an advocate for people with disabilities. There are still issues, action alerts, different advocacy campaigns that are currently in progress, and it's critically important that we continue to advocate during this situation. What is COVID-19? Let's start with the basics. It is a disease that affects the human respiratory system. So when it presents in humans, it affects the part of the body that controls breathing, which is obviously very, very important. It is also referred to as the novel coronavirus because it's new. So it's a new disease that was not known to scientists before the end of 2019. And I thought this point was kind of interesting. It is called the coronavirus because the actual shape of the virus cell has kind of little points and spikes on it like a crown. So we're going to get more into the shape of the virus later and how that manifests in the body. Just know that COVID-19 is an illness that is spread when germs from a sick person get into another person's body. I think that's kind of the easiest way to express what it is and how it affects humans. So again, this is the cell, this is the virus kind of germ under a microscope. You can't see that shape with your eye, but again, I think it resembles a little crown. So why is it called COVID-19? This infographic really breaks it down. CO stands for corona, again, coming from crown, little spiky shapes of the virus. Vi, it's a virus, and a disease. So it first was known to us in 2019. We also know that the World Health Organization deemed COVID-19 a pandemic early in March of 2020. So what does pandemic mean? It basically means it's an epidemic or a specific disease that's spread over multiple countries or continents. So think of it in like sizes. A pandemic is huge. It could affect the whole world, many different countries, many different continents. Whereas an epidemic, kind of a step down, it affects a smaller area than a pandemic, but still affects a large number of people within a community, population, or specific geographic region. So I bring this up just because, again, today we want to discuss facts. We want to refer to the different points we're talking about in an accurate way. So it's not an outbreak. It is considered a pandemic by WHO, the World Health Organization. So how does the virus spread? It is spread when someone who is infected with the virus coughs, sneezes, or otherwise expels the germs of the virus from their own body into the air, actually physically onto another person, or onto surfaces, hard surfaces that can hold on to the germs until a healthy person touches them and again brings the germs into their own body. So everybody at this point has probably heard, stay at home, wash your hands, stay safe. We're basically pushing that message because that is the best way to avoid contracting the disease. To stop the spread, we need to contain the germs and not allow them to spread to healthy people. So if you do, this applies to any other time. If you have allergies, if you have a common cold, if you have the flu, you want to make sure that you are being responsible for yourself. So sneeze into a tissue and throw the tissue out. Don't hold on to it. Don't tuck it back into your pocket. Throw it out into a waste bin. I like this graphic. That's the vampire cough or the vampiric sneeze. You basically just sneeze into the crook of your arm or your elbow to keep all the germs basically onto yourself. And again, cough into a tissue and toss the tissue out. No one likes this. We are kind of a culture. We extend our hands. There's a certain amount of touch that goes on throughout our day, shaking hands and whatnot. Nothing is worse than watching someone cough or sneeze into their hand and then try to say hi. So this is a nice graphic that sums it up. Keep your germs to yourself, protect yourself, vampire cough. And this is the message that goes along with it. Coughs and sneezes spread diseases. So again, we want to make sure that in order to avoid contracting any kind of illness, any kind of communicable disease, we are keeping our coughing and sneezing etiquette up to date. Throw out the tissues. There's no need to hold on to them. You want to make sure you're covering your major mucous membranes, as they're known, your mouth, nose, with a tissue if you're coughing or sneezing. And if you just are in a pinch, you don't have the tissue, cough into your elbow. Or bring your shirt up over your face and cough into your shirt. And again, we're going to get into hand washing etiquette a little bit later, but if you are not able to wash your hands immediately, hand sanitizer works really well for getting the germs off your hands, but make sure that as soon as you can, wash your hands well. So I'm going to show you all a very quick clip that basically sums up what we just talked about. Why is it so important to actually cover your nose and your mouth when you're coughing or sneezing? Well, let's check this out. MIT researchers produced this image of someone coughing or sneezing, and it shows just how far our coughs and sneezes actually travel. So let's check it out. Wow. So an interesting point about this particular study is that It is not specific to COVID-19 because you can see here this was created in 2014. But when we think about a sneeze or a cough, I mean, at some point in our lives, maybe we've been sneezed or coughed on by someone else. You might be able to feel it hit your skin. You can feel the liquid part of that cough or the sneeze. But what we don't see, and what the MIT researchers were looking at, is the gaseous part, the gas phase of the cough or the sneeze. So it's not visible to our eyes, but wow, does it travel? So again, really, really important to keep our germs to ourselves. And when we're talking specifically about the COVID-19, about the coronavirus, which is a disease caused by, and the scientific name is SARS-CoV-2. SARS-CoV-2, not to be confused with the SARS outbreak of 2003, but it is basically, COVID is a type of coronavirus. So some common colds are coronaviruses. COVID-19 is a coronavirus that specifically its goal is to attack the lungs, to get deep into the lungs. Okay, so that's an advanced stage of COVID. And not everybody will get to that phase. Some people are only going to feel upper respiratory symptoms. So you have probably heard about the symptoms of a dry cough, maybe a sore throat, just general kind of body aches and pains. Some people say this phase of the disease, when those germs first get into the body through the mouth, the nose, or the eyes, or through our own hands when we touch the germs and touch our face, when it's all up here, the symptoms are different than when the germs actually get to go all the way down through the respiratory tract and hit the lungs. It gets really, really serious down here. And I'm sure at this point everybody has heard of those more serious symptoms. And we'll get into those later. But basically, when the virus enters, you feel it up here. You feel it in maybe the back of your throat, a sore throat. It might feel like a really bad cold or a bad version of the flu. It's not, it's different. But just remember that once it enters your body, the goal of the COVID germ is to make more of itself. So your respiratory tract, your throat is going to swell. You're trying to fight it off. You're working really hard, which is why your body might feel really run down because it's working to make you feel better. But again, the goal of the virus is to get there in the lungs where it likes to live. It's able to make itself more quickly. So I really like this graphic because I think it kind of sums up what happens when maybe the germs are spread through the air and enter the body, which reminds us of why it is critically important to wash our hands, keep our germs to ourselves. So again, as I said, COVID is not the same thing as a cold or a flu. Some colds are caused by coronaviruses, which is a whole big family of viruses, but COVID is different. Some of the symptoms are similar to a cold or flu. You would have some coughing, but with COVID, dry cough tends to be a symptom, a very early symptom of the disease. And then you will see a fever, a higher fever at well above 100 degrees, 100.4, 101. You will also feel tired and run down, again, because your body's fighting really hard to try to get rid of those germs, stop them from reproducing, and build up your own immune system. We work hard to try to make ourselves feel better. I also want to, oops, I just saw a message that my audio was down for a little bit. I hope that everybody can hear me now. So when we talk about other symptoms of COVID-19, we also might feel muscle pain, achiness, overall body achiness. And then down here, we kind of get into the more severe symptoms of the disease. And again, that is when we're looking at when the germs are kind of entering the lungs. So we see the lower respiratory tract symptoms when the virus is able to enter the lungs and the bloodstream. We see those more severe symptoms, like difficulty breathing, which can be very, very scary. This is a very serious symptom, and that's where you want to make sure when you start experiencing these symptoms, we're going to talk a little bit next about the time frame for that. When should I see a doctor? When should I let my doctor know? But certainly these are more severe symptoms. You want to get in touch with your doctor immediately. If you have trouble breathing, you have chest pain or pressure, or confusion. If it's hard to wake someone and they haven't been feeling well. So I found this chart produced by the New Jersey Department of Health. And I think it's really, really helpful in determining how you're feeling. You can relate how you're feeling, okay? So if you're not sick, you have no symptoms of fever, cough, or difficulty breathing, you still need to wash your hands frequently, just in case you come in contact with germs, COVID germs that could be living on different surfaces. You also want to practice social distancing. We're going to get into that a little bit more. And in general, stay away from people who are sick, who you know are sick. In that case, your risk level is super low. If you're staying at home, you're taking the precautions, you do not need to seek medical treatment. Let the doctors focus on people who are in the more high risk states. So that's specifically people who may have traveled to an area where COVID was running rampant, very high rates, or if you're actively experiencing symptoms. So I include this because I think it breaks everything down into a nice way. It was produced by a reputable source, the New Jersey Department of Health, and they want people to feel empowered, right? They want you to know what actions you should take based on how you feel, your health status, and they'll let you know kind of what your risk level is based on different factors. Okay, so feel free to use this, share it, spread it around. I think it's a really great resource. And other New Jersey specific COVID resources, the symptom checker. This is actually really cool. You can actually go through a self-guided kind of quiz. Let this, you can fill out the information based on how you feel, and they will basically advise what you should do. Do you need to seek immediate treatment? Should you just watch and see, wait and see? Do you need to self-isolate? And also, if you prefer to call, if you have general COVID questions, dial 211. And that's a 24/7 kind of hotline. And again, it's run through the state of New Jersey, the Department of Health. So the person on the other end of the line should have factual information to share, and they can answer your questions. And if you have specific medical questions, this is the number to dial. Okay. I would also say check out the New Jersey covid.nj.gov website. They have a ton of great information. It might not be necessary to call. You might be able to find the answers to your general questions on the website. And of course, they have a number that you can text and receive alerts and updates. Like I said, we are finding out new information, it seems, every day. So it's important to get that information from a reputable source, information that is factual and accurate. So one of my team members actually shared this video with me, and I think it's really, really helpful in explaining how we can help stop spreading the virus. What can we do as individuals to help spread this virus? So let's check this out. So I really like that. And that video was produced by the Ohio Department of Health. Very suspenseful. The music makes you feel like it's like a movie, action movie style. But it is a very serious issue. We need to all work together to stop spreading this virus. It's spread from person to person. So the goal here is really to flatten the curve. I'm sure that everybody has heard that phrase recently. That is the goal of social distancing, of staying apart, physically staying apart from other people, other than the people that you live with and who are not sick. So feel free to share that video. Again, that was produced by the Ohio Department of Health and can be found at this link. And all of the links, check the sources at the bottom of each slide for the source of the information included in the slide or to access the video on your own. Oops. Okay, so I love this graphic. I think it really spells it out. Our goal here is to stay 6 feet apart from other people when we are in public. Nowadays, we should not be in public even close to as often as we were, let's say, 2 months ago. But when we do go to seek an essential service, go to the grocery store, go to a medical office to seek treatment for an emergency, we want to make sure that we are maintaining social distance. Basically, stay 6 feet apart from other people. You don't want to get within 6 feet of someone else. Because remember that video that I showed before? Those coughs and sneezes are spreading diseases. We know that the germs spread very quickly and easily and even further than we might have thought, but generally 6 feet is a good distance to not come directly in contact with germs from someone who is sick. And something else to remember, if you feel okay, you still want to maintain the social distance. You still want to stay at home. We're going to get into specifically why we're going to do that in just a little bit, but in general, the quickest, easiest, best way to stop the spread is to stay at home. Okay, so of course, anytime, whether we're dealing with a global pandemic or not, we are trying to avoid contact with people who are sick. That's just something that we need to do. So especially now, even if someone in our household is sick, we want to build in extra precautions to make sure that we are not coming in close contact with them. So if someone in your household is sick, just like the chart said before, you want them to self-isolate. You want them to stay in a bedroom and use a separate bathroom if possible. You want them to maybe use separate plates and knives while they are sick with the virus. But to the most extent possible, you want to make sure that people who are healthy in the home, asymptomatic, are staying apart from the person who is sick. That's just the easiest way to stop the spread within a single household. And if you do decide to go out, you make sure you follow the social distancing rules. So stay at least 6 feet apart from other people. And you want to make sure that you wear a mouth face cover. So wear a mask, a bandana. You can also do this yourself. You don't need a medical grade surgical mask. Just keep that in mind. You can make a mask. People are getting super creative online. It's awesome to see. And I personally like to wear gloves. I had them at home before this. I just like to wear them. But make sure even when you're done shopping, if you're done with your grocery shopping, throw out the gloves in a receptacle, in a garbage can, and wash your hands thoroughly once you're done unloading the groceries and your home. In general, it's a pretty good idea to just avoid touching your face. We tend to touch a lot of things throughout the day, a lot of different surfaces. We could be picking up germs, and in general, we don't need to be touching our face. So keep your hands off your face. This is I think a new skill that everyone's kind of hopefully mastered at this point. But especially don't put your hands near your eyes, mouth, or nose, because again, those are our mucous membranes. They can pull in the germs and make us sick. And when we talk about washing our hands, we need to use soap and water and spend at least 20 seconds seriously scrubbing our hands. If soap and water are not readily available at that moment, you can use an alcohol-based hand sanitizer, but you want to make sure to check the ingredient list and make sure that the sanitizer is at least 60% alcohol, because scientists have found that that is the percentage of alcohol that you need to actually kill germs. And just as a note, I've seen some news stories where people purchased homemade hand sanitizers from different stores. You want to make sure in general that you're not purchasing those homemade hand sanitizers, because in some cases they can contain really harsh chemicals that can actually burn your skin or hurt you. But in general, if you do buy secure packaged hand sanitizer, make sure it's at least 60% alcohol. All right, so we're going to get into the specifics of disinfecting. This is how we can stop the spread at home. We want to make sure that we're cleaning high touch surfaces often. So I'm sure we all clean our houses. It's our favorite activity, but even now it's really, really critical that we're disinfecting frequently, daily if possible. And so you're cleaning off doorknobs. Everybody touches those. Everyone's on their tablets or their phones, so make sure you're wiping those down with an alcohol-based cleaner. You're not spraying it onto the phone, but maybe wiping the phone down, wiping the surface down. Don't drench your phone in alcohol. That is not a good thing. But basically cleaning other high-touch surfaces in your home, which look a little something like this. So if you can imagine, a lot of people going for snacks in the fridge, wipe down the handles of the fridge and freezer. Cabinet, same thing. And you also want to make sure light switches, and this is a really critical one. So when we're done using the bathroom, if we go to wash our hands like very responsible adults, we're still touching the handle with a dirty hand. So you want to make sure that you're wiping these down often. And of course, the door to the bathroom, the toilet bowl, the flusher, you want to make sure that these surfaces especially are highlighted and part of your disinfecting routine. You want to stop the spread at home. And I came across a great recipe for a do-it-yourself disinfectant spray. So before I mentioned not buying disinfectant sprays or homemade hand sanitizers from stores or from random folks, you want to make sure that if you are making a disinfectant spray, you know what goes into it. So you're making sure you're making it per this recipe, so to speak. And it's kind of like a Lysol spray, because I know right now the actual branded Lysol spray and Clorox wipes are in some places very, very difficult to come by. So there is a way to create a disinfectant spray you can use at home that's safe, just with a couple ingredients. And it is as effective as Lysol because it has a good ratio of disinfecting ingredients like hydrogen peroxide and alcohol. Because remember, when we're talking about disinfecting surfaces, the virus spreads from person to person through the air. If we sneeze, cough, expel the COVID germs into the air. But also if someone coughs onto a surface, sneezes onto their hand and touches a surface, the virus can live on surfaces, especially metal and glass, for quite a bit of time. So it's important not only to wash our hands and keep our bodies free of the germs, but we're touching the surfaces that frequently come in contact with other people, especially if we're living with multiple people in a single house. So you can divvy it up. You can decide which high-touch surface will be your disinfecting spot for the day, but it's got to be something that's built into the household routine to stop the germs from spreading. And if you do use Lysol, disinfecting wipes, or a disinfectant spray, keep in mind that these aren't magic. They don't work typically on contact immediately. Yes, they promise to kill 99.9% of viruses and bacteria, but if you read the ingredient list and the instructions, you will see that it takes, in some cases, several minutes for the disinfectant to work. So you can't spray the door handle and then grab it right away and expect all the germs to be gone. That's not the case. So pay close attention to the instructions on your cleaners. Take a look, make sure you're using it in the appropriate way, the specified way. All right, we're going to get into some myths and facts. And again, this is sourced from the World Health Organization. It's an international organization that produces a lot of great information right now about COVID-19, preventing the spread of the illness. It is a reputable source. Coronavirus, there's a lot of myths running around. You might have seen some on social media. We want to keep in mind that washing ourselves with bleach, spraying bleach-based products anywhere on our body, under our nose, this does not prevent the virus from entering your body. Instead, it may give you a really gnarly skin rash, skin irritation. Most people do not do well with bleach directly applied to their skin. It's very dangerous. So there were some articles that suggested putting bleach under your nose to prevent, again, the germs from getting into a mucous membrane. But the fact is that chemical disinfectants like bleach, like alcohol, can kill the virus on hard surfaces, and that's what they are meant to do. But they can be very, very dangerous if applied directly to human skin. So again, it's best to wash your hands with soap and water. And a really interesting point that I wanted to share about the effects of soap and water on COVID is that soap literally destroys, it just demolishes the virus cell. The virus is kind of structured. Again, it looks kind of like a crown, right? You can take this as like a little coronavirus germ that's flying through the air. It has its little spikes like a crown. It comes into contact with your hands, and it's sitting on your hands. You can't see it. Once you apply soap and activate it with water, soap is actually two-sided. It has like a side that jumps onto water, and it has a side that attacks fat and binds to fat to get rid of it. And actually, the whole little COVID germ is kind of covered in a layer of fat. So once the soap busts through that fat layer, it really essentially destroys the virus germ. So soap, antibacterial soap, is super, super effective in getting rid of the virus from your hands. That's why it's critically important to wash our hands well, and for at least 20 seconds, because again, soap isn't magic. It takes a little time to get rid of those germs, approximately 20 seconds to fully remove the germs from your hands. Okay, but please don't apply bleach to your face or anywhere on your body. It's just not safe. Okay, so when we look into, this is actually, I've seen these on the walls at different hospitals, different day programs. This is the appropriate way to wash our hands. You want to make sure your hands are wet. As again, the soap is activated by water. I just think this is a really nice graphic. Again, it goes through every single point, every single question you could possibly imagine. But I think that it's something that can be shared widely. And again, knowing that soap attacks the virus. Soap is really, really effective in killing the virus because of how the virus is structured. So when you hear people say like, listen, just wash your hands, stay at home, wash your hands, it really is good advice. And here's a fun little playlist that we shared in our most recent issue of Positive Pulse, our newsletter. But Spotify actually produced a playlist for songs to wash your hands to. So that's fun. You can mix it up. Apparently, the choruses of all of these songs are actually around 20 to 30 seconds long. So again, if your hand washing takes 15 to 30 seconds, you can sing to yourself and make sure that you're properly washing your hands and getting rid of those germs. And thanks to this Twitter account, we found out that Staying Alive by the Bee Gees has a chorus that's 24 seconds long. So again, it doubles up as a song that you can sing to go along with the CPR, right? With the chest compressions. I learned that from Paul Kring over at the Arc of Union County, a fantastic first aid CPR instructor. But it also is helpful if we keep that in mind for when we're washing our hands. So now we're going to get into another kind of hot topic. So we know at this point that if we are going out into public, we do need to wear a mask or some kind of face cover. So this really breaks it down. Are you a medical professional? If you are, then hopefully you have access to the N95 or surgical masks. The N95 is a respirator. Surgical masks are just a different grade of face mask. If you're not a medical professional, if you're not a doctor, EMT, nurse, you do not need one of these masks. Please don't buy these up. Even if you could get them, please do not purchase them. They should be for medical professionals only. So you can sew your own cloth mask, or you can cut a mask out of things that you have around the house. There are a ton of tutorials online, very low cost, if not free options for creating a face cover. If you have a bandana, wear that. If you have a ski mask, balaclava, if you have a scarf, you can put whatever you want around your face. The goal is to really block the mucous membranes. Remember, we're blocking our mouth and our nose because that's where the germ tends to enter our body. You could also make your own mask, again, with a pillowcase or a cotton t-shirt. Check out this handy tutorial on YouTube for your own, how to make your own mask, and even if you don't have a sewing machine or know how to sew. So again, when we talk about the quickest and easiest way to stop the spread of the virus, it means staying at home. We're not hanging out with our friends right now. We're not gathering. The most important thing to do is stay at home in order to stop the spread. So you can leave for essential and necessary reasons, like picking up food for yourself and your family. Going to see your doctor. And again, go back to that flow chart. Do you actually need to go see your doctor, or can you call them and do a telemedicine visit? Every doctor that I've heard from is offering that option. You can also leave the house to pick up medicine, prescriptions, but keep in mind there are also delivery and at home or through the mail deliveries of prescriptions. You can also leave the house to exercise or relax in your yard. I would caution that in many areas of New Jersey, we're a densely populated state, taking a walk around the block may not be a good idea. You may be getting stir crazy, but maybe if you just take 10, 15 minutes in your yard, that will keep you safer than walking around the block where tons of other people might be. So before you leave your house, just ask yourself if it's absolutely necessary. Because remember that we're trying to stay at home to flatten the curve, which means that we are doing everything we can to limit the spread of the virus, because we do not want to see continually high numbers of people getting tested and testing positive for COVID. So this chart produced by University of Michigan basically says this is what it means. Here's the curve, right? Here's the blue curve, here's the yellow curve. We want the yellow curve. We want to make sure that the number of people trying to get treated by doctors and in the hospital isn't overwhelming the hospitals. So it's important that we stay home and stay safe. So you might be asking, like, I feel okay, I'm fine, I don't have any symptoms of the virus. Why do I still have to stay at home? Because the doctors and nurses are asking you to. No, it's really, really critical. This is something that all of the experts in the world on viruses are talking about. It is important to stay home because we do not want to overwhelm the hospital system, the medical system. There's only so many ventilators, there's only so many doctors, there's only so many hospital beds. If we do nothing, we could overwhelm the system. But if we stay at home, stay away from other people, especially people who are sick, we can kind of keep things under control and make sure the people who are really sick can see the doctors and nurses that can make them feel better. So this is a graphic that's been spread online. Doctors and nurses just asking people stay at home because they're still going to go to work and help people who go to the hospital. This is a graphic that was created by a police department in New Jersey to really sum up social distancing. When when Governor Murphy told us all to stay at home, the stay-at-home order, also being called quarantine by some people, but it's really a stay-at-home order, an executive order. It means we're not hanging out with friends, even if we're 6 feet apart, even if it's only a couple people, even if you've all stayed at home for the past couple weeks. Basically, we are staying home no matter what. Even if you miss your family, and I'm sure many of us do, you cannot go to your parents' house to hang out if you don't live together. You need to stay apart from other people. So again, I think this is a graphic that sums it up well, and is a positive message that can be shared. We need to say no. We need to stay at home. We're all kind of in this together. We can all play a part in flattening that curve. And here are some resources for grocery delivery, curbside pickup. Curbside pickup basically means no contact. So when I went, I just popped my trunk. They put the groceries I ordered over the phone into my car. No contact with other people. So here are some options. Amazon Fresh does it. Shop right from home. Peapod for Stop and Shop. There's a lot of different options. If you click this link here, this is a live link to a full list of current available groceries, kind of online grocery order companies. Your pharmacy may offer to deliver your prescription to your house, so you can contact your pharmacy or insurance company for more information. Also keep in mind farm stands and farm markets in your area. Target also does curbside no contact pickup. There's options for getting what you need while also staying at home. And we're going to go through some myths about COVID. It is not true that COVID can't spread in nice weather. There are many countries in the world experiencing beautiful weather right now, but also experiencing COVID. So it's important not to spread this misinformation. COVID can affect people of all ages. It doesn't only, quote unquote, only affect older people or people who have other health conditions. That is not accurate. People who have other health conditions may be more vulnerable and may get a more serious version of the virus and may feel worse, but it can affect all people. And unfortunately, taking a hot bath does not prevent the disease. It doesn't burn off the germs on your body. It is important to clean your hands and to stay safe and maintain your hygiene routine. But taking a hot bath doesn't allow you to then be immune to the virus. And again, these infographics were created by the World Health Organization. It's an international organization that's trying to spread information and facts about the disease. So feel free to check out their website and spread this factual information. Another point about what you should do if you do feel sick. You need to isolate yourself and call your doctor. Don't immediately run to your doctor's office. They may be overwhelmed. There may be, many sick people at the office already. You need to call first. Don't ignore your symptoms, but don't go running out the door directly to your doctor. Isolate, contain yourself in your bedroom, use a separate bathroom if you can, and call your doctor. If you start to feel really bad, way worse, update your doctor, call them, email them, text them, whatever way you're getting in touch with them. But especially these emergency symptoms that I mentioned before. If we're having trouble breathing, persistent chest pain, if the person is not waking up, you need to seek immediate medical attention. And this is a resource I wanted to share that was created again in Ohio really stepping up. It is a health passport for people with intellectual and developmental disabilities. So it can be downloaded for free here, but it's a list of different medications the person may be on, symptoms and risk factors, as well as their personal assistance needs and how they express themselves, things they like, don't like. So again, I would urge you, if you are a member of a community provider organization, check this out. This may be worth spreading to your whole network. A lot of people have concerns about what happens, especially if a person who is nonverbal enters the hospital. From what we hear, the rules about one person only being admitted, you can't have visitors, you can't have assistants, they're kind of holding firm with that. So this would be a good resource to have if a parent, guardian, or support staff cannot make it into the hospital with the person. And these slides will be posted after the presentation along with a recording. So feel free to check that out. So ultimately, when we're talking about spreading misinformation, when we're talking about conjecture, when is this all going to be over? When can I get back to work? When am I going to get to, am I going to get to go on vacation as I planned? How about camp? Anybody who says otherwise anybody who pretends like they know is not being truthful. We do not know the answer to those questions right now. That's why it's important to stay current, keep getting credible information. But right now, we don't know when things are going to go back to normal, so to speak. We know what we can do is spread factual information. Avoid things like spreading rumors. This was shared a couple weeks ago on Facebook. It said, prepare for a total lockdown. You won't be able to leave your house. And then it asks you to spread. It's kind of like a chain letter, if anybody remembers that. It's not based in fact. It's not helpful. Sharing rumors like this and false information like this it has a whole bunch of typos in it, and it's not official. It's not actual information. It can really scare people. So as much as possible, really share factual information with the people in your life, because rumors and false information only serve to stoke fear and anxiety. So check the Centers for Disease Control and Prevention website right here, or FEMA, Federal Emergency Management Agency Administration, as well as the World Health Organization. There's a ton of resources at the end of this training that you can check out as well. Also, I want to just mention a couple frequent or a couple recent scams that have been happening. PSE&G in Long Island produced this graphic. Apparently, people were attempting to contact PSE&G customers through the phone, email, and actually showing up at people's door and asking for immediate payment, or else their services would be shut off. This actually did happen, but again, it is a scam. So when in doubt, if it's PSE&G calling, your credit card company, your phone company, contact the company directly rather than listen to a person who may be trying to scam you. So you can learn more by clicking here, the PSE&G website. But if you hear about these different scams, verify that it's true and always contact the company directly. So I want to now kind of move into our, take a couple minutes just to talk about some things we can do to really help ourselves stay engaged and active while we're all at home. Hopefully everyone is feeling as zen as this infographic, but if not, let's discuss that. So the first and the quickest and perhaps the easiest thing we can do is just take a deep breath. I think everybody's feeling a little bit overwhelmed right now, but taking a deep breath actually signals to our body that it's time to chill. It's time to relax. So just try to practice that a little bit more, build that into your daily routine, and it's amazing at what a difference it can make. As I said before, it's still critically important to respond to action alerts and to keep advocating. I've outlined 2 recent action alerts here. You can literally click these links to take action now. These involve responding to Congress about the COVID-19 relief bill and making sure people with disabilities are equitably represented in those bills, as well as fixing the glitch for SSI. So again, respond to the alerts. You are making a difference. It is a very difficult time, but especially we try to break it down into a very digestible way. Clicking a link, providing input, showing your support. So sign up for our email list or the ARC of New Jersey's list to make sure you're receiving these action alerts. And these are relative to COVID-19 issues, but these happen throughout the year as well and affect people with disabilities, self-advocates, as well as family members and direct support professionals. Another really great way to manage our stress, manage our anxiety, is taking a step outside. And even if you only have a little sliver of a yard, even if you only have a balcony, I think it's important to just go outside, take a breath of fresh air, watch the birds, just take a couple minutes and be out of your house. We all have to stay at home, but we can still step outside in our backyard or on our stoop or porch, just to get that little breath of fresh air and a break. It makes a huge difference coupled with our taking a nice deep breath. It can really go a long way to calming us down. I also want to share a link to the New Jersey Self-Advocacy Project Instagram page. We were following a schedule for weekly adaptive fitness videos. So meditation Monday, animal yoga Wednesday, and superhero Friday. We're doing short adaptive yoga routines 3 days a week, along with our brain games live on Facebook Thursdays at 1 o'clock. Join us on this Thursday at 1 o'clock to play Scattergories. It's important to keep our brain active and engaged, build in a little creativity. And when you're watching the fitness videos, you could always move your routine outside. If you're watching the yoga video on your phone, take it outside. Take your tablet outside into your front or backyard and just take in some fresh air. So again, check out our Instagram page, Facebook page, Twitter. We're trying to put out good content that focuses on staying active, staying engaged, and continuing to advocate even though we're apart. So if you're a part of our statewide self-advocacy network, make sure to check in with your regional advisor to get the schedule for our upcoming conference calls. We are still, self-advocates are still at it. We're still working and staying connected even though we can't be together physically at this point. Here are some ways to stay engaged with friends. You can use Google Hangouts, WhatsApp, Skype, FaceTime. I mean, there's so many ways to physically see people on the phone or just chat it up. It's important to maintain those social connections. So at this point, I would like to know, let me see if there are any questions that we have not addressed yet. If you have questions, you can reach out to me directly. Follow us on Twitter, Instagram, Facebook. Reach out to us on the website. But if you have any questions, please do not hesitate to reach out. And I do see that there was a question about masks. Someone asked for adults with disabilities. Should they wear a mask? Absolutely. At this point, if we're going out into public, we should all be wearing a face cover. So again, you can make your own mask. You can purchase a mask, but just make sure you are covering your mouth and nose as much as you can when you are going out. Oh, and a great point by Caroline. If you've ever heard a rumor about essential oils killing the virus, that's not accurate. You cannot use just a pure essential oil to kill the virus. We want to make sure that that information is spread widely. We are using soap, water, hand sanitizer when we can't wash our hands. So thanks for that point. All right. Well, thank you again for joining in. We greatly appreciate your support, and we hope that you will join us again next week for the Stay Healthy at Home webinar series on staying connected and communication while we're all staying at home. Thank you all, and I hope you have stay safe, healthy, and have a good afternoon.